In the third section of our lecture, now we will talk about some uterine abnormalities or congenital malformations that involve the uterus. In this section, we will talk about the vesico-vaginal, recto-vaginal fistula, and persistent urogenital sinus. And also we will talk about the classes of different uterine abnormalities. So associated abnormalities are the vesico-vaginal fistula. Fistula is the connection between two structures, and as the name shows, usually the fistulas are named after the two structures which are connected or joined. So as in the vesico-vaginal fistula, vesico is for the bladder and vaginal is for the vagina. So it's the fistula or connection between the bladder and the vagina. So it is formed when the Mullerian eminence rupture into vesico-urethral part of the cloaca instead of the pelvic part of the urogenital sinus. So again, it's a congenital malformation, and it is due to the abnormal rupture of the Mullerian eminence in the vesico-urethral part instead of into the pelvic part. So because of the rupture into the vesico-urethral part instead of pelvic part, this leads to the formation of the fistula. Then the recto-vaginal fistula is between the rectum and vagina. This is due to Mullerian eminence that opens into the dorsal segment of the endodermal cloaca. So these are the two abnormalities. Congenital malformations leads to the formation of fistulas, and then one is rectovagina, since the rectum is in the dorsal part. So in this, the Mullerian eminence open in the dorsal segment. So that leads to the rectovaginal fistula. So this is the both can lead to complications. So fistulas need to be repaired. So this is if you see, this is the bladder, then the clitoris, vagina. So any fistula or any connection between the rectum and the vagina usually leads to the complications like passing of the fecal matter through the rectal opening, or there might be blood coming out of the rectum during the menstruation. Similarly, the urine output from the vaginal opening. So all these complications can occur. So it needs to be repaired. Then we have persistent urogenital sinus. Persistent urogenital sinus leads to its irregularities of urethral and vaginal orifice in the sinus. Now, different uterine abnormalities. Uterine abnormalities we have divided into different classes. In class 1 of uterine abnormalities or anomalies, there is Mullerian agenesis. There is hypoplasia segmental. So in class 1, there is agenesis. So here there is cervico-vaginal agenesis, absence of the cervix and vagina, that is under the class 1. There is complete absence of the vagina and the cervix here. Uterus is present, you can see. So there is Mullerian agenesis, hypoplasia segmental. This hypoplasia is limited to the cervix and vagina. So class 1, cervico-vaginal agenesis. Then next, class 2, there is unicornuate uterus. Uterus unicornus. You can see there is unicornuate uterus. Cervix, vagina is present, but there is just one cornua of the uterus, unicornuate uterus. Then in class 3, there is didelphys uterus. Here, uterus didelphys. You can see two separate cornua of the uterus are present. In this, there is unicornua or unicornuate uterus. This is uterus didelphys, in which we have the two cornua of the uterus, and they are separate too. And then in the fourth class, there is bicornuate uterus. The uterus has two, like the unicornuate, there are two cornua of the uterus. They are combined together, not like didelphys. In class 5, we have septate uterus. This is the uterus, that's the septate uterus, septum in the uterus, uterus septus. Then class 6, there is arcuate uterus. And then in class 7, there is, due to DES, diethylstilbestrol related abnormality, and there is rudimentary horn. Here, there is uterus, and separately there is small rudimentary horn present, so which is non-communicating. All these are the different classes of uterine abnormalities, congenital abnormalities. All these can lead to infertility. All these are usually since congenital, no treatment is usually present for all these congenital anomalies of the uterus. Then another uterine abnormality, same how these can occur because of failure of development of one or both Mullerian ducts. Absence of both ducts leads to absence of uterus, including oviduct. So if there is absence of both Mullerian duct, it can lead to absence of the uterus along with the oviducts or fallopian tubes. Again, this is the diagram that shows unicornua, one cornua of the uterus, bicornuate connecting together. Bicornuate uterus is similarly looks like didelphys uterus, but the difference is in bicornuate, the two cornua of the uterus, they are attached. In this, they are separate. They are two separate. And then we have septate uterus. There is septum present in the uterus, and this is the arcuate uterus. So absence of both Mullerian ducts leads to the absence of uterus and fallopian tubes. Failure of recanalization of Mullerian duct leads to agenesis of upper vagina or of the cervix. So again, if you see the two difference between the two embryonic developments, Mullerian ducts are the ducts that leads to the formation of genital tract structures. If there is complete absence of Mullerian duct, there is definitely complete absence of uterus and fallopian tubes. If there is failure of recanalization, or if there is failure of the formation, opening of the or recanalization of Mullerian duct, there is agenesis. So it is associated with partial agenesis, leads to agenesis of upper vagina or the cervix. Also, there is failure of fusion of Mullerian duct. So very commonly, complete absence, failure of canalization. If canalization occurred, there is failure of fusion that leads to fusion problems like lateral fusion abnormalities if there is failure of the fusion of Mullerian ducts. That was all about the malformations of the classification of the uterine abnormalities. Thank you for watching sqadia.com.